I am your Chief Medical Officer, and I'm here to speak to you about COVID-19. A little background on COVID-19. This virus was first identified in China in December 2019 and have since spread globally and have been reported in over 210 countries with over 6 million confirmed cases. We may be asking, what is coronavirus? This is an infectious disease caused by SARS-CoV-2 virus, which is severe acute respiratory syndrome, coronavirus 2. And this virus causes illnesses such as common cold, severe acute respiratory syndrome, and Middle East respiratory syndrome. It is important to note that this virus spreads very quickly, and there are a few groups that are at risk. While everyone is at risk for contracting coronavirus, there are a few groups who are most affected by the symptoms of this virus, and those are children, the elderly who are immunocompromised, and also chronically ill persons, such as persons with heart and lung conditions, and also persons with cancer. So what are the symptoms of coronavirus and when do they appear? Symptoms may appear between 2 to 14 days after exposure to an infected person. It is important to note that some persons with coronavirus can be asymptomatic, meaning that these persons do not show any symptoms. Whereas with a person who is symptomatic, they would show symptoms such as fever, coughing, tiredness, and loss of smell. The coronavirus infection can be severe in some cases, where persons may experience difficulty breathing or shortness of breath. There might also be loss of speech or mobility or confusion. Symptoms can extend as far as chest pain. In the event that you or a loved one present any of these symptoms, I urge you to contact your primary care physician, or you should seek medical attention at the nearest health facility or hospital. If your symptoms are not as severe, you can manage pain such as fever at home. However, I urge that if you do experience any of the severe symptoms, and I will reiterate, such as difficulty breathing or shortness of breath, if you or a loved one experience any chest pains or loss of speech or mobility or confusion, and you believe that you do have coronavirus, I urge you to seek immediate medical attention. How is this virus spread? This virus can be spread from many ways. One of it is from person-to-person contact. When we come into contact with persons who are infected with the coronavirus, we can contract the virus ourselves. If a person that is infected coughs, sneezes, if they speak, breathe, or sing, then small particles can land on us and we can contract this virus. The virus can also spread in poorly ventilated indoor and outdoor spaces, and we are seeing that in a lot of other countries where there are large events being hosted, known as super spreaders, that there are high or alarming rates of COVID-19. I am urging you to avoid poorly ventilated places. I'm urging you to avoid large crowds. Also, this virus can be transmitted when you touch surfaces or objects that are contaminated with the virus. You can also develop symptoms. What should you do to prevent getting COVID-19, or if you suspect that you have the virus? Firstly, prevention. I urge all to wash hands with soap frequently, or in the event that you cannot wash your hands with soap and water, I urge you to use an alcohol-based hand sanitizer. A fitted mask should be worn at all times in public spaces and around persons. If you suspect that someone near you or you may be having symptoms, I urge you to wear a well-fitted mask, and I urge you to encourage others around you to wear a mask. Again, avoid large crowds, as the spread of COVID can occur really fast in large crowds. This virus can spread. It can only take one person to spread this virus, to transmit this virus to 3 different persons. Now, if one person is positive for COVID-19, tested positive for COVID-19, or presenting symptoms, and they get into contact with different persons, they can infect 3 persons. These 3 persons can then infect 3 persons, and that is the way that the COVID-19 virus spreads. If you are showing any symptoms, or you believe that you might have been in close contact with someone that has COVID-19, I urge you to isolate yourself and to get tested. I also urge everyone to get vaccinated. There are a number of vaccine options available to you, which I urge all of you to use. There are vaccines available for children from as young as 5 years old up to the elderly. The only way that we can control the spread of this deadly virus is if we get vaccinated and if we follow all protocols in place. I just want to give you some tips for you for COVID-19 and to prevent the spread. If you do need to sneeze, I urge you to sneeze in your elbows or to cover your face. Again, I urge everyone to wash their hands with soap and water, as well as to sanitize often. Cover your mouth and your nose properly by wearing a well-fitted mask, and avoid crowds and social distance from persons if you are in public spaces. Maintain a distance of 6 feet from the person nearest to you. We all need to play our part to reduce the spread of this deadly virus and to end this pandemic. Again, be COVID safe. Wear your mask, wash hands and sanitize. Get tested. That is the only way that we can confirm whether or not we have COVID-19. Maintain a physical distance of 6 feet from persons near you. Get vaccinated. That is the only way that we can save our lives. Also, if you believe that you or a loved one have COVID-19 and you are presenting symptoms, and those symptoms are believed to be severe, such as chest pains, difficulty breathing, I urge you to present yourself to a medical center or to contact your healthcare provider. We all have to play a part in reducing the spread of this deadly virus and ending this pandemic. Thank you.